When should you use hot and cold therapy for your injuries? Introducing hot and cold therapy. Great solutions for inflammation, stiff muscles, joint pains, and other injuries. Understand your body's injury response, leading to an inflammatory process that could cause discomfort for weeks if left untreated. Cold therapy is an effective and affordable treatment for inflammation. It constricts blood vessels, reducing blood flow and inflammation while providing temporary pain relief. Ideal for recent injuries, it reduces the risk of the condition worsening. Cold therapy is not just for injuries. Use it after physical activities to help manage pain and fatigue. If you've just undergone a surgical procedure, you can also apply cold therapy to the area to hasten recovery. For chronic aches and pains like stiff joints and muscle knots, heat therapy is the answer. It dilates blood vessels, promoting relaxation. It's great for easing muscle and period cramps, but avoid using it on inflamed areas. Proper use of hot and cold therapy is critical. Always use a cloth barrier between your skin and the pack and limit contact to 10–15 minutes. Allow your skin to return to normal temperature before reapplying. Certain conditions prohibit the use of hot and cold therapy, such as diabetes, Buerger's disease, stroke, and hypertension, which can impair a person's ability to feel temperature, so using hot or cold therapy can do more harm than good. Always consult your doctor before use. In conclusion, hot and cold therapy are simple, inexpensive solutions for muscle pain, injuries, and joint issues. Use them wisely for speedy recovery or injury prevention. Don't forget to share this valuable information with friends and family. We would love to hear your thoughts in the comments below. Discover the power of natural healing through hot and cold therapy, a safe and affordable way to manage pain, promote recovery, and improve overall well-being. Thank you for watching. If you find this video valuable, please like, share, and subscribe PhysioMedics.